Okay, so at first I would check my MAR and my doctor's order. I would compare those two. I would check for the patient's name, the medication, the right time, the right dose, and the right route. I would also look in my drug book. I would see like the rate of administration, the correct dilution, and if it's a safe dose, and mine is. So I'll be given gentamicin for my IV piggyback, and I'll be given Lasix for my push. For Lasix, and I would look for their potassium levels because it can affect their potassium levels. I will also check the MAR for if they have any allergies or anything. Okay. I would wash my hands before gathering my equipment. Okay, so first I'm going to grab up 7 milliliters of my Lasix because that's how much my doctor ordered. Okay, and I will also label my syringe. Okay, now I'm going to get my IV piggyback ready. I would check the bag for the expiration date for any separation or any particles laying around in it. And I've already labeled my bag. And I've also already spiked it. I've already primed my tubing. I would prime my tubing to make sure, all the air bubbles are out and everything. Okay, now I'm ready to head into my patient's room. I would wash my hands before going to the patient's room. I will identify myself. I'm Xavier Cole. I'll be your student nurse for today. Your doctor has ordered you to get my IV push and an IV piggyback of medicine. Can you state your name and date of birth for me? All right, and do you know if you have any known allergies? And if the patient doesn't have any allergies, I would check the site, looking for any redness or swelling. And then I will also check my patency of my IV. I would do this by lowering the bag. And I do see blood return. Alright, so first I'm going to give my IV push. I'm going to apply gloves, wash my hands again, and apply gloves. I'll also check to see if my IV piggyback and my IV push is compatible with the primary fluid, and they both are. I'm going to find the port closest to the arm. I'm going to pinch it. I'm going to do a push and pause method. My book says to give this medicine over 1 to 2 minutes, so that's what I'm going to do, using the push and pause method. While I'm doing this, I would ask the patient if they feel any burning sensation, any pain, and I would also still assess the site for any swelling or infiltration going on. been 1.5 minutes. All right, and I'll throw this in the sharps container. Okay, now I'm gonna hang my IV piggyback. At first, I would lower the primary IV fluid. And after that, I will still assess the site and make sure that it's no warmthness, redness, or swelling. Okay. I'm going to connect it to this port. I'm going to clean it again. Alright, now I'm going to make sure all lines are open. And I'm going to get 8 drops per minute, and I'm going to do that by the primary. Okay, I got 8 drops per minute. Alright, and my drug book says to infuse over 60 minutes. So I will leave the patient comfortable. I will assess the site again. After that, I will ask the patient, how does it feel? Like, how are they feeling? Are they feeling burning sensation or any pain? I will look at the site and make sure everything's okay. I will leave the patient. I will come back in 60 minutes. I will rewash my hands again, identify my patient name and date of birth, assess the site, and look at this and make sure if it's running properly still. Then I will discontinue it. I'll wash my hands. I'll make sure this is closed before I undo it. Okay. And I will hang my primary fluid back up. And I also would redo it to where the healthcare provider order had wanted it, and I would set it back to where he ordered. I will leave the patient comfortable, bed in lowest position, wheels locked, collar within reach, and side rails up.